Hi, welcome to another edition of Healthy Exchange. I'm John Reynolds, President and Chief Executive Officer of CieloStar, and I'm joined today by Pierce McNally, our Chief Strategy Officer. And we're going to talk about another very contemporary trend in the benefit market today, which is the trend toward defined contribution health. Now, many of you are familiar with defined contribution retirement, and today we're seeing a major shift towards defined contribution health benefits as well.
Defined contribution health benefits are gaining traction in the marketplace for a variety of reasons, John, not the least of which is that it plays into the entire consumer-directed health movement that we're seeing in this country, so that consumers are going to have more say over their health choices, and the defined contribution market allows them greater choice and, in general, greater number of products from which to choose in the marketplace. So, just as people find themselves with numerous choices when it comes to allocating their money for a 401k plan, we're going to be seeing more and more choices like that when it comes to defined contribution healthcare solutions. And one of the reasons that the healthcare solution that's of defined contribution is gaining more and more traction in the marketplace is because of concerns over cost. And we've run into a lot of employers who have told us that.
Well, no doubt about that. When you take a look at healthcare inflation, we're seeing rates that are running well into the double digits. In some ways, you may look at it and say that they're very close to 19 and 20%. As we look at premium increases as a result of the Affordable Care Act and some of the extensions of benefits associated with these new plans, it's driving premiums up in the 25 to 40% range. So no doubt that from a consumer's perspective, defined contribution is going to provide more engagement and is probably going to help to get more participation from employees. But from an employer's perspective, this is a very unique way for them to be able to increase budgetability for purposes of these benefits.
It's also a great way for employers to make a new benefit available to their employees through a private exchange, because defined contribution allows for people to come to an easily accessible website for purposes of comparative shopping and transparency in pricing to determine what's best for them, not only for major medical but also for the voluntary benefits. And our CieloStar healthcare benefits exchange is set up to do exactly that, and that's why we've had such interest from so many employers about moving from this defined benefit solution to a defined contribution solution in the context of a private exchange.
So really what's happening with defined contribution benefits is it's a true win-win. It's a win for the consumers who've been asking for more transparency and more choice. And it's a win for the employers as a way to basically control their exposure to the rising cost of healthcare and benefits at large.
And next week, back on Healthy Exchange, we will have a compelling topic for you, and we can't wait to see you back.